I'm demonstrating one of my favorite exercises to help reduce the irritability in an angry knee joint. My name is Roxanne and I'm a physical therapist from PT Health Academy. Do you have an irritable knee? Maybe you have pain when you get up out of a chair. Those first few steps are painful. Maybe you have pain going down the stairs. These are common symptoms when you have a knee problem. And this exercise can really help ease those symptoms a bit. The repetitious nature of this exercise creates an increase in blood flow throughout your leg and knee by repeatedly pumping the muscles in your leg, the big muscles, your glute muscles, your quad muscles, and your calf muscles. Also, there are several structures within your knee that depend on motion for their nourishment. So the more you move, the more you push those good nutrients into the soft tissue structures, into the cartilage of your knee. And this action can really help with calming down knee symptoms. You're basically creating a big flushing of your knee. You're washing out the irritants within your knee and you're washing in the good things that your knee needs to heal and feel better. A couple coaching points on this exercise. If you're finding that your knee is tender with this band kind of cutting into the back of your knee, then you can use a towel behind your knee, between your knee and the band, to create a cushion so that feels better. You also want to pay attention to the amount of motion that you push through your knee with this exercise. Let's say I was having pain every time I straightened my knee all the way. Then I would shorten that up and not hit that end point with every rep. Same thing with forward. If it was painful going forward all the way, then I'm going to shorten it up and not go into that painful endpoint with every rep. Movement that is not painful is nourishing to your joint. So if you're just pushing through a lot of symptoms with every rep, you're really just going to stir the joint up and make it more angry. So listen to your knee and shorten the motion if needed. After about 20 or 30 reps, you can revisit those endpoints and see if they're less painful, and if they are, then you can go ahead and do full motion again. The other thing you can adjust is the tension on the band. The harder you pull against a very tense band, you're increasing the muscle contraction, which is good for the pumping action, but it also creates more load and compression in the knee joint. And if your knee is really stirred up and angry, it may not like that increased load. So moving closer to the door to lessen the intensity of the pump is a good idea. And then once your knee starts to feel better and you're okay with it, then you can back up and add more tension again so that your muscles have to really create a nice tight contraction and improve the pumping action. So finally, how many reps do you do and how often do you do them? I would recommend starting with anywhere between 60 and 80 repetitions. You really want a lot of volume to create the changes that you're looking for. And then if after you do the exercise, you find that you do feel a little bit better, you have less ache in your knee, or you're able to go down the stairs with a little less pain, then you know this is good medicine for your knee, and you can go ahead and safely take that medicine multiple times through the day. Just remember that every time you do the exercise, you have to apply the same principles, because sometimes your knee might feel really good going through full motion, and other times you need to shorten it up a little bit. And adjusting for those changes is important to make sure that you get the most out of this exercise that you can. If you like this video, again, please hit the like or subscribe to my page so that you can get informed anytime I put out another tip on this YouTube channel. Thank you so much for listening.